regardless of pre-existing condition, while maintaining cost control as a priority. That's principle number one. Number two is that no American should be forced into a government-run health care program. Those of us who've seen what happened in Washington, where the government is now mandating that every individual buy health insurance, to me undermines that entire bill, because where in the Constitution does it give the government the power to do that? I don't believe that that exists. In fact, a number of attorney generals around the country are bringing suit, and that could bring this House of Cards down. That's why the Supreme Court appointment is so important too. Number three, allow Americans who like their current health care coverage to keep it and guarantee the right for all to choose the right plan for themselves and their families. Again, this is where the problem exists. When they talk about having a health care plan that you want to keep, well, as companies begin to shed their responsibilities or their coverage for their employees, you're going to find yourself with very few options except the newly created exchange, where your choices are going to be very limited. There is a right way and a wrong way to do it. We miss the mark. Fourth, ensure the medical decisions are made by doctors and patients, not government bureaucrats. And finally, improve the overall health of Americans with effective prevention, wellness, disease management, while continuing the development of new life-saving technologies, treatments, and cures. Those are principles that I think we probably can agree on as a country, but I'm afraid we took the wrong track. Next slide, please. I have just a couple things that I've been talking about where, unfortunately, we didn't adopt these to a great degree. The fundamental problem in healthcare has really been access to the individual insurance market as well as cost containment. Those are the two things that, had we seriously addressed, we would have been able to, I think, build a consensus and get the kind of reform that we need. You can do that by providing tax credits for individuals to enter the individual insurance market. Since World War II, employers have been able to provide health care coverage and other fringe benefits to people on a pre-tax basis. But if, for example, you leave your job and you find yourself in COBRA or you're self-employed or something of that nature, you've got to buy your insurance on an after-tax basis. We need to level the tax treatment, and then on a means-tested basis, provide tax credits to give people the ability, when they get into the individual insurance market, to have the resources they need then to go wherever they want to go to buy their insurance, by expanding the choices available to them, by knocking down the barrier to buying insurance across state lines. That doesn't exist today, and nothing in this bill changed that. The other thing that, again, has been a real, I think, a benefit, is something that's worked very well, is the HSAs, the health savings accounts. The amount that you've been able to put into your personal health savings account of your money, spending it on the tax-free basis, and then being able to roll it over, giving you the power to make decisions about your own health care choices. For example, if one person wants to buy eyeglasses because that's their need, someone else has a different condition, they can use that money. They can make choices about how they're going to spend their own money. As soon as we put a third party into the mix, as we've done with healthcare for so long, it removes all of us from the decision-making process as to how the money is spent. And every time you do that, you lose control. Costs expand. That wasn't done. In fact, those were limited. Fourth, I believe strongly that you can't fix healthcare without addressing tort reform. And there was very little, if anything at all, in tort reform in this bill. And it isn't just to minimize the jury awards in these these cases that you all read about. It really is to sort of change the practice of defensive medicine that has driven up the cost of health care precipitously because of the trial lawyers lurking around there. Now, nobody wants to deny someone who has truly been hurt in the process. But by adopting something called a gross negligence standard for health care, you can ensure that people who truly were victims can get the compensation they need. But that, and you talk to any physician, some of you may be physicians, you know that isn't the case. And so tort reform is essential. Now, I also believe that pre-existing conditions are something that we do have to address. But rather than mandate that from Washington into these individual insurance companies, we can create high-risk pools in each and every state that allow for individuals who cannot get underwritten to have insurance of last resort. To some degree, Blue Cross fits that mold in Michigan, but it doesn't, it's not entirely. And most of the rest of the country doesn't have that. The difference, I would say, is, look, insurance companies haven't been completely blameless here. What we need to be able to do is to make sure that people contribute the monies that they have, but also ask the insurance companies, if they're failing to underwrite individuals because of pre-existing conditions, to contribute to that pool to ensure that those resources are there. So pre-existing conditions are not a limitation to care. Finally, another step is to really create wellness incentive programs. Much of what you've seen in this bill is a transfer of wealth, if you will, from the healthy to the sick. Now, my heart goes out to people, no question about it. But I also know that there's very little incentive, and people are driven by incentives, in order to maintain health. If you're out and you're taking care of yourself and you're keeping your weight down and you're not smoking and you're living a good life and you're doing everything you can, well, you know, there should be some benefit to you for that. And again, many things are out of people's control. But a lot of physicians will tell you that much of our problems, our chronic problems today, are individual choices that people make, are lifestyle decisions that they themselves decide to do. And there's very little incentive now because, you know, they're going to be in the same boat as before. My point is, let's create wellness incentive. People are motivated in that regard. Those are some of the issues on healthcare, and we will come back to that in any sort of question and answer period. Suffice it to say, I am not a supporter of the Obama plan. I think it is a mistake on a lot of different levels, from the cost, which is going to be well over $1 trillion, to the job loss, which we've already seen in a couple of sectors, to the very fact that particularly seniors and others are going to not just lose their prescription drug benefits, as has already been the case. There's been a number of write-downs from big companies, but the impact on Medicare. Yeah, I think one of the main criticisms that I have of the Obamacare bill is they tell you that they're going to finance this by cutting $500 billion out of Medicare for senior citizens. And they're going to do that by eliminating waste, fraud, and abuse. Well, my view is if there's $500 billion of waste, fraud, and abuse, why don't we eliminate that for its own sake? Why do we need Obamacare to address that issue and then turn around and pay for something else? The truth is that money is not there to that degree. And if it was, I don't even trust the government to go and find it. So I'm afraid that this cost is truly a smoke and mirror, because when you use that kind of money to underwrite this, you have real problems. One last point on Obamacare. As you know, we pay for it for 10 years, but we only get 6 years of benefits. That's how they make the books balance. They cook the books. And I just think that that is a fraud on the American people. I think the way it was passed was inappropriate. I do believe that health care reform is necessary, but not this reform. And my view is that we need to replace this, we need to repeal it, we need to replace it, and we need to go to Washington after this next election and use the power that we have to find choke points in this health care bill to deny its implementation. That's my view. I look forward to being a part of it. Again, not saying no, that we don't need health care reform, but not the kind of health care reform that's going to bankrupt not only our generation, but can you imagine what's going to happen to future generations? Well, if I could, I'd like to move on to just a couple points on jobs.